Amy Campbell speaking with us today. Amy is actually the lead for SelectWell's integrative wellness coaching. So, Amy, thank you for joining us today.
Thank you.
Okay.
Glad to be here.
Wonderful. Well, before we start, I just want to share with everybody that first, Amy is a PharmD. She still is practicing as a PharmD, but she's also, for SelectWell, she is a certified integrative wellness coach. So why don't we just jump into it? Because I think the first thing anybody's thinking right now is what is integrative wellness coaching? So Amy, can you help us understand what is integrative wellness coaching?
Of course, yeah. So integrative health and wellness coaching is a collaboration between a coach and a client, whereby the coach serves to assist and support the client with positive, sustainable lifestyle change. So when the coach gives the client support, the client's able to tap into their own internal motivation and find the resources needed to live a life on a day-to-day basis with positive actions in their life that are gonna lead to a very healthy lifestyle. And the integrative part of integrative wellness coaching is just that. It's that wellness is an integrative state. A lot of people think of health as, a good diet and lots of exercise. But we do recognize and know that optimal wellness consists of many more areas of health, such as adequate sleep, adequate stress management, personal connections, a positive physical environment, life purpose. So there are many other aspects of wellness that are very important to overall optimal health. And we look at all of those areas, including movement and nutrition as well.
One of the things that we've talked about that you spoke to is the fact that integrative wellness coaching uses what are called behavioral change models. Can you share a little bit, explain what these models are, maybe a little bit about specific behavioral change models you use and why they lead to more improved or sustained behavioral changes for individuals?
Sure. Again, with the wellness coaching, people think of wellness coaches as wellness experts, which we do have a great deal of knowledge in the wellness sector. However, our true expertise is in behavioral change, and we do utilize specific models when we're working with clients to help bring about, the positive changes that are needed. Probably the most common one that comes to my mind initially is that of motivational interviewing. And that's where we utilize very powerful communication. We ask the clients very engaging questions and give them free space to answer the questions. And during that time, they really are able to come to their own internal recognition of what's important to them. And when they are able to connect that value to what it is they believe in and why it is they want it, they're able to make the changes necessary to get there. And so that uses a lot of the techniques within motivational interviewing. Also, at the core of coaching is empathetic listening. We really are just there to listen to the client and be present with them and show empathy. Other models that we use, the trans-theoretical model for change was developed, and that's based on the theory that there are 5 stages of changes that folks go through, and knowing that depending on which stage you're in, you may or may not be ready to move forward. And coaches are able to recognize at what stage the clients are in and implement certain techniques at the correct stage, knowing that if you try to push something too soon, it's probably going to backfire and go the opposite way. So we really want to recognize and meet the client where they are. We're here to see, you know, this is where they are, and that's okay, and discover, you know, where do they want to be, and know that it's okay to be here, and we'll get there eventually. Some other models that we use, positive psychology, really looking at what the client's strengths, basically. We utilize what works for them. And obviously, when you're trying to do something and you're utilizing your own internal strengths, it's going to be easier for you. And if it's easier for you, you're going to be more likely to do it, and it's going to produce the outcome that you want.
I think one of the things I try to always try to understand is do you pick one model over another depending on the individual? Do you use one model at a time? I mean, how do you decide how these models are put into play?
Yeah, no, I wouldn't say that it's done like that at all. We're just taught the basis behind all these models, and they're just several tools that we have in our toolbox. And you know, you never know where one conversation might go from one client to the next. These are all just skills and tools that we are taught, and can utilize them however we see fit during each interview or each, you know, meeting.
Well, the one thing we keep saying is coaching, and coaching keeps coming back up. Everybody has a preconceived notion of coaching. And I think one thing that everybody needs to understand, or at least can you help them understand, is what is the difference between integrative wellness coaching and what most people think of when they think of coaching?
Yes, that's a very good question, because it is very different, actually. Traditional coaching models, as you know, involve the coach usually telling the client or the athlete, whoever it is that they're working with, it's centered around the coach and what the coach wants for that athlete. And the coach is doing the talking, the telling, the instructing of what to do. With integrative wellness coaching, it is completely the opposite. As coaches, we recognize that clients are the experts in their own health. We give them the space to determine what it is they want and really understand why it is they want it, and let them drive the ship. And we're just there to facilitate the forward movement. So that's the main difference. It really is a client-centered, structured collaboration, as opposed to the coach being in charge. The client is the one in charge. And we know that when clients are the ones in charge, they're very much more likely to make the changes necessary.
We started off by the fact that I acknowledge that you are a certified integrative wellness coach. Can you tell us a little bit about that certification process and how you went about it personally?
Yeah, sure. So I studied at Duke University's Integrative Health and Wellness Coaching program. It is one of the several accredited programs that are available throughout the country. The field is a really rapidly growing field, and there are several training programs out there that may not be accredited, which is fine, but as the field continued to grow, the International Consortium for Health and Wellness Coaching recognized the need to set some basic standards to verify that the coaches that you're working do have a minimum level of education. And so I went through Duke's program, fabulous program, learned a lot about myself doing it. It was 4 days at the university and then a period of a couple of months where we did our own self-study, and then 4 days back at the university learning and collaborating with our cohort, and then, you know, a test through that. And after the test, you are required, in order to sit for the national board, which I'll talk about in a minute, you're required to have at least 60 hours of one-on-one coaching. And then I sat for the national boards. And so the same organization that provides the accreditation for the programs also collaborated with the National Board of Medical Examiners, the same board who writes the pharmacy exams and medical exams for, you know, physicians or pharmacists. And they created a national board exam that you can sit for and pass, and then that gives you the national board certification credentials, which is what I have.
Well, wonderful, and congratulations on doing it.
Thank you very much.
So that's very cool.
It's been a very fun journey for sure.
With this, obviously with SelectWell, we do acknowledge that behavioral change is central to actually making our program work. And integrative wellness coaching is how we're going to bring about that behavioral change. Can you share with us, why did you decide to join SelectWell? Why did you decide to bring your talents as a certified integrative wellness coach to SelectWell? And what do you hope to accomplish by being part of SelectWell?
Yeah, sure. Yes, I agree that with SelectWell, our mission really is to identify those at high risk for chronic disease management and help them prevent, you know, progressing further down the path of disease and get them flipped around toward the path of wellness. And like you said, lifestyle management is at the core of what's necessary for chronic disease, because most of these conditions are actually preventable through lifestyle management. And as a practicing pharmacist over the past 20 plus years, it's very unfortunate that I see that we're getting sicker and sicker and sicker despite the many new medications that we have. And it's just within my heart to really start with that first step for wellness, and that is our behaviors. The choices that we make every single day greatly impact our health and well-being. And sometimes it's difficult. We live in a pretty difficult culture where it's hard to live a lifestyle of health and wellness on a day-to-day basis. But I really do want to help clients make the changes necessary to move toward a path of well-being and prevent chronic disease, as opposed to just throwing some drugs at them. Don't get me wrong, drugs absolutely have their place. But I do want to facilitate, help people sleep better, help them have a good diet to support them.
Yeah. And one of the things, Amy, I was just going to add is you spent some time telling me your beliefs that unfortunately the U.S. health system has moved into this kind of mindset and paradigm that we really practice sick care in the U.S., not health care. Anything you'd like to add just here at the end, just this idea of how do we get off of this focus on sick care, and how do we get people back over to what we truly should be practicing, which is health care?
Yeah, that's a very good question, and I think one that a lot of people are really trying to figure out. It's not easy. I do think that awareness is the first step. I think it's just become so much the norm, the type of lifestyle that we're all living now, So just bringing awareness to clients that, hey, you know, wow, look, your fasting insulin level is really, really high. You know, just bringing that awareness, and then again, facilitating them and making the changes needed to get that reversed. I do think that it's going to have to be a value-based care system where we're all focusing on the value that we're providing for clients as opposed for the fee-for-service. You know, the more you're seeing, the more you make, right? It should be based on the outcomes and how truly well are we getting our patients as opposed to, oh, you need this and this and this and this.
Okay. Well, Amy, thank you for spending time with us today, and hopefully we'll see you in later videos. But and want to thank everybody for listening in.
Yeah, thank you.
Thank you.
Enjoyed it.